Another day, another story. Definition of hypertension. Hypertension, also known as high blood pressure, is a chronic medical condition characterized by elevated pressure within the arteries, which can lead to various complications if left untreated. Blood pressure is measured by two numbers: systolic pressure, the top number, and diastolic pressure, the bottom number, which represent the pressure exerted on the arteries during heartbeats and between heartbeats, respectively. Normal blood pressure is generally considered to be 120/80ths of a millimeter of mercury or lower, while hypertension is defined as having a systolic blood pressure of 130 millimeters of mercury or higher and/or a diastolic blood pressure of 80 millimeters of mercury or higher, as measured on at least two separate occasions. Prevalence and incidence. Hypertension is a very common medical condition worldwide. According to the World Health Organization, WHO, hypertension affects approximately 1.13 billion people worldwide, and this number is expected to increase to 1.5 billion by 2025. The prevalence of hypertension varies among different populations and age groups. In general, the prevalence increases with age and is higher in men than in women before age 65, but becomes more common in women after age 65. The incidence of hypertension in the U.S. has been decreasing in recent years, but it remains a major public health concern due to its association with various cardiovascular and renal complications. Risk factors. There are several risk factors associated with the development of hypertension, including age. The risk of hypertension increases with age, as the arteries tend to stiffen and become less compliant with age. Family history. There is a genetic predisposition to hypertension, and having a family history of hypertension increases the risk of developing the condition. Obesity. Being overweight or obese increases the risk of hypertension, as excess body weight puts a strain on the heart and blood vessels. Physical inactivity. Lack of physical activity is associated with an increased risk of hypertension, as regular exercise can help maintain a healthy weight, reduce stress, and improve cardiovascular health. Poor diet. A diet high in salt, saturated fat, and processed foods, and low in fruits and vegetables, can increase the risk of hypertension. Smoking. Smoking tobacco products can damage the blood vessels and increase the risk of hypertension. Alcohol consumption. Heavy drinking can increase blood pressure and contribute to the development of hypertension. Chronic conditions. Certain chronic conditions such as diabetes, kidney disease, and sleep apnea can increase the risk of hypertension. Stress. Chronic stress can lead to elevated blood pressure and increase the risk of hypertension. It is important to address these risk factors to prevent or manage hypertension and its associated complications. Thanks for watching.